The UNMC College of Dentistry Dental Clinic is located on the third floor of the Durham Outpatient Clinic in Omaha, Nebraska at 4400 Emily Street. We have a reception area, a business desk, and then a private consult area. In 2019, there was a $2.6 million renovation of the clinic space, and we expanded our number of chairs from 6 to 15. 4 are plumbed with nitrous, and we have pulse oximeter units, in-room x-ray units, electric handpieces, and the option of air-driven ones as well. We have dual screen display so we can present x-rays to the patients. In this first hallway to the right, we have 4 hygiene rooms that are pretty much equipped to do what we need, one with nitrous, and we also have some office space for our billing clerk and our support staff. And on the left is one of the doors into our sterilization area. Our sterilization area begins with a contaminated area for the instruments that are brought from the patient rooms, where they are cleaned and packaged into a cassette system, run through the melee, and are dated and stored in our storage area. Following packaging in our sterilization area, we have a large steam autoclave and 2 statums for steam autoclaving of our instruments that are in cassettes that are then stored in our clean area, and you can see one of the cassettes in our no-touch doors that we can open for instrument storage when sterilized. Our dental lab with storage, plaster for pouring models. We have a glazing furnace for Emax. We have a hand grinder for model work, a triad machine, a suck-down machine, an air abrasion unit, and then a lathe for polishing and grinding. And then our lab cases are poured and set up and processed from here. And in the back hallway, we have 9 treatment rooms, quite similar to the other one. Just wanted to show that we do have some high vac machines for evacuation during aerosol procedures. We have 2 card access locked storage areas that we can keep some of our equipment in. In here we have 3 Wave 1 endodontic units. We can also store and charge up our translation tablets in this room. Our attending desk is in the hallway of our other treatment rooms, where we are available to assist our residents throughout their day of patient care. This is our x-ray room where we have a digital pan-ceph machine. We also set up some of the other items we have in our clinic. We have a Cirac MCXL milling machine for doing zirconia crowns and Emax crowns. We have a Cirac Omnicam machine, and also we have a Carl Zeiss scope for endodontic procedures for those that choose to use it. We also have started using a Trio scanner for some of our cases. We have a Nomad handheld x-ray unit for some of our special needs patients to make it easier to take our digital sensor x-rays. Our Speedfire oven. We also have clinical cameras and a Gemini diode laser for in-clinic use. One of our larger rooms is set up with a hover chair. It allows us to move the chair out of the way for patients that don't transfer. They may be in an electric bed or a wheelchair, and then we can provide them care. This is our conference room where we are able to have our didactics with our residents, and we have a large screen display that we are able to record and present Zoom to our residents that are not on site. In the back hallway, we have the offices and the changing room and the employee break room. This is the program director's offices. Office for the resident coordinator. We have a staff break room. When providing patient care, we change into scrubs, so this is for our staff and residents, locker room and changing room. Our residence room is equipped with a display screen that we can project from our computers for cases and treatment plans. We also have dual screen monitors and workstations that they can do their notes and view patient records. The UNMC College of Dentistry is located an hour's drive from our Omaha clinic. When residents are on rotation at the dental school, there is an area known as the Silver Clinic where there is a dedicated chair, assistant, and lab area for residents' use. Also in the Silver Clinic area, there is a digital dentistry room and Dr. Bennett's office, who is demonstrating on a lab exercise model. There also is a negative pressure room in a surgical specialties clinic and 2 more operatories in the Silver Clinic that are undergoing renovations to make them into negative pressure rooms, and the renovation is near complete. The resident and assistant uses this office space in Lincoln. It has dual screen computer stations for access to patient records and use for Zoom.